All right, those of us who are now back in the room are going to be rewarded by being here at the beginning of the afternoon session and really hearing, I think we've got an outstanding panel lined up to continue this discussion we've had this morning. And I was just saying to Rebecca here that, and it applies to you too, Chris, you've got big shoes to fill. We had a terrific morning.
I know, don't oversell it.
No pressure. But this is an important topic, and I know that you guys are going to help us with it in terms of adding further to our understanding and to the dialogue that we like to have at these roundtables. You know, we can't make recommendations in roundtables. You know, consensus studies do that at the Institute of Medicine. But what we can do is have good, sharp, informed, engaged dialogue that stimulates others to take action. That's one of the reasons we have these roundtables. And we have them webcast so that they can be available to people not only now as they're watching, but asynchronously over time, as well as producing the summaries of these workshops that have also a durable life. And consistent with that, I'm going to remind you all to be thinking about your comments and insights that you want to offer during the conversation period. It's also important that that get noted during the workshop itself, so that when the rapporteurs put together the summary, that the dialogue and your thoughts can be included in that. So I think we've got people back, most people now. We've got a panel now that are going to address address approaches to informed consent. And we've got two people on this panel. And again, I'm going to ask you to hold questions and comments until after they're done presenting. Dr. Rebecca Sidori is a geriatrician and a hospice and palliative care physician at the San Francisco Veterans Administration Medical Center and an associate professor at the University of California, San Francisco. She has designed, tested, and informed consent process for patients with limited literacy and an advanced directive that is both literacy and culturally appropriate. Her current research program is focused on creating and testing culturally and literacy appropriate tools to help patients engage in advanced care planning. And then following her is Chris Trudeau. He's an associate professor at the Thomas M. Cooley Law School. He teaches all form of legal research, analysis, and writing. And he's a zealous advocate for plain language and has focused much of his research on combating archaic traditional language in law, healthcare, government, and business. Professor Trudeau is active in the Legal Writing Institute, Scribes, the American Society for Writers on Legal Subjects, and Clarity International, an international plain language organization. He's also spoken on health literacy for the Institute of Healthcare Advancement, the Food and Drug Administration, and other healthcare organizations. So, Dr. Sidori, you are up. Thank you.